Good evening, students. Today we will discuss candidiasis. As you must be knowing, this candida infection is basically an opportunistic infection. Opportunistic infection means the infection caused by organisms which already are present in our body, but whenever they get the opportunity to flourish, to bypass the immune system of the body, they flourish in the body and they produce the signs and symptoms. So, what are those opportunities which Candida finds to produce signs and symptoms? First, you must know what are the various places where it can hide. It can be present in the oral cavity, it can be present in the esophagus, vagina, under the breast, and in the web spaces of the hand and feet. So, whenever there is hot temperature, there is moisture, there is low immune system, so these candida fungal, or you can say the organism, find the opportunity to flourish themselves and produce signs and symptoms. So, whenever there is low immunity, so when there is low immunity, when the person is at the extremes of ages like the infants and the elderly people, the people who are taking antibiotics, who are taking anti-cancer drugs, who are in the post-operative period taking lots of antibiotics. So, these candida infection or the candida organism or fungus finds opportunity to flourish, otherwise it remains suppressed in the body in the various cavities. So, you must know what are the various factors that can give rise to these candidal infection. So, if it is in the oral cavity, it can produce white patches. If it is in the, suppose in the sexual organs, vagina, it can produce white purulent discharge, balanoposthitis in case of males. When the married couple is there, then we have to give the treatment to the both simultaneously. Similarly, the patient in the post-operative period are more susceptible, so we must take care that we should not give undue antibiotics. We should stop the antibiotics as soon as possible in a required state. So, whenever we require the antibiotics, we should not continue for a very long time. So, these are the things that you must know about the candida. So, about the treatment, there are local infections can easily be treated with the local application of the antifungal drugs, like in case of oral you can give fluconazole 1 or 2 dose. In case of vaginal and the balanoposthitis, we can give the local pessaries for females and the local application in case of males. So, similarly in intertrigo, where the infection is present in the web spaces, we can apply the local antifungal agents. So, let us start with the whole lecture where you can understand what are the various places, how it spreads, what are the various signs and symptoms, how we can treat the various infections, or you can say the infection caused by candida at various sites in our body. Thank you very much, and let's get started. Welcome. I am Dr. R.K. Dua. I am a founder of Fun, Learn and Earn system for dentists. This is my new system for teaching and learning. So, today's topic is candidiasis. So, what exactly is this candidiasis? This candidiasis is a fungal infection. That fungal infection is caused by the candida which is already present in our body. And whenever this candida finds good opportunity. When is a good opportunity for the candida to flourish in our body? When our immune system is down, we are on chemotherapy, we are on post-operative period. So whatever is the cause, or we are taking antibiotics for a longer duration, and that causes alteration of the normal flora of the intestine. So that gives opportunity for the candidiasis to grow. So normally this candida is present in our body in small amount in healthy persons. So it is whenever the infection occurs, it is not a primary infection, because infection occurs from the organisms candida which is already present in our body. So only in the newborn that candidal infection occur as a primary infection, and that too from the mother. So what are the various forms of candida infection can occur in the presentation of the candidal infection? First is the severe intertrigo. That means the infection of the folds of the skin, like this. These are the folds. And the folds between the toes of the feet. Because these feet many times remain in the shoes from morning to evening, weather is hot, moist, and the feet are soaked in the sweat. And over that, there is no time for the drying of the foot. Patient that or person that is suffering wears the shoes in the morning and removes the shoes at night. So in these cases, there is severe intertrigo, there is severe itching is there will be small erosion of the epithelium of the skin will be there. Then comes the nail fold and local plus systemic infection. So nail folds, the nail becomes whitish or brittle. So this could be a fungal infection. So all these nails, just like you do like this, it will break like any glass or something like that. Then superinfection of the gut oral cavity. All these normal flora which are present in our oral cavity, in our gut, these also play important role in the prevention of the or invasion of the outside bacteria or fungal infection. When we take antibiotics for a longer duration, we are taking the chemotherapy. So mainly in case of antibiotics, this normal flora is disturbed, and the candida, this finds good opportunity to attack on the host. So in this case, the candida infection spreads throughout the intestine, or maybe in the oral cavity in the tonsillar area. When this candida occurs in the tonsillar area, you can find there are small spots or dots are present in the tonsillar fossa or in the mucosal surface of the oral cavity. So the main cause is the prolonged antibiotics. Next is the vaginitis. Similarly, the vagina remains moist, and sometimes what happens when the immunity of the patient is decreased, as this candida is normally present in very small quantity in the vaginal flora. So when the infection occurs, that means the patient is having low immunity. So what are the various stages or common causes of low immunity in the females? First is the pregnancy. Because the pH also changes, pH changes along with the moisture is there, and the candida finds it good opportunity. Diabetes mellitus, low immunity, high blood sugar level, and many times in case of females, candidiasis and melanoposthitis in case of males. when because of no other cause all of a sudden these things appear. So one must rule out diabetes mellitus. We must do the blood sugar. So many times this candidal infection is just a presentation of appearance of diabetes in a person. So whenever vaginitis is there and we are providing a treatment to the female, so we must also treat the male partner also. Because of contact, male partner may be having belanoposthitis because of the candidal infection. We are giving the treatment and ultimately when the contact occurs, the partner transmits the infection from himself to herself. So that treatment should be given simultaneously to both the partners. So in case of pregnancy, we have to, or otherwise we can give local clotrimazole and nystatin cream to the male, and even in case of female when she is not pregnant, we can also give the pessary that can be kept inside the vagina overnight. So next is the thrush. What exactly is the thrush? Thrush is basically the candidial stomatitis, that means candidal infection of the oral cavity. White patches in the mouth and the tonsillar fossa appear. So also in case of AIDS, in case of infants, post-operative patients and ill-fitting dental plates. Because these ill-fitting dental plates keep on chronic irritation and because of the presence of moisture, there is proliferation of the candidal infection. If the patient is diabetes also, that also increases the high chances of such kind of infection. So what are the various causes of candidal infection? One we have already discussed, the broad spectrum antibiotics that can cause the change in the flora of the oral cavity and the gut. So that can also change the flora of the respiratory tract. So this gives the opportunity to the latent and dormant candida which is present in our body to proliferate and produce the disease and produce the symptoms of candidiasis. So systemic candidiasis, in this case, these candida invade the lung or the blood stream. From there, these candida can spread to the whole of the body, and in case of immunocompromised patient, in the post chemotherapy and the post transplant where the immune system of the patient is depressed by giving the medication, so that there should not be rejection of the graft which has been placed in the patient's body. So in these patients, if the because of low immunity, because of the immunosuppression that is being caused deliberately to reduce the graft rejection. So in these cases, the chances of systemic candidiasis are very high. So we have discussed the post chemotherapy, post organ transplant can cause systemic chemotherapy. So what are the various modes of treatment? So various modes of treatment depends upon the how much the disease is there. If it is a localized vaginitis, localized belanoposthitis, oral thrush is there, so that can be easily managed by local anti-candidial or antifungal creams. So local we can give pessary for the vaginitis, and these pessaries or antifungal pessaries should be avoided in case of pregnancy. So in case of pregnancy we can give gentian violet solution to the female, and if the treatment occurs with gentian violet then it's okay, otherwise we have to shift to the some other agent. So as long as it is possible to stop or not to give during the pregnancy, it should not be given. So first try the gentian violet. If there is no effect of the gentian violet, then we have to weigh the consequences and the disadvantages. So what are the various medication pessaries which are available for vaginitis? clotrimazole, miconazole, iconazole, isoconazole, and these should be given for 1 to 6 days. Ketoconazole tablet can be given 200 milligram twice a day for 5 days. Treat the male partner for balanoposthitis. Clotrimazole or nystatin ointment can be given to the male partner for local application. So sometimes when the disease becomes systemic, so in those cases we may have to shift to the intravenous or the oral antifungal agent only in case of severe. So many times all these organisms are present in our body, but we don't know whether these are present in our body or not. So as we have studied that these are normally present in small quantity in our oral cavity, in our intestinal tract, but these are not able to produce any symptoms or disease process because our immunity is so strong, our flora in the oral cavity and the gut are so strong that these flora does not allow the candida to grow in the oral cavity or in the intestine. So now you can understand that our immune system is so silent and so on auto mode that we rarely get to know that our immune system is working or not, because many times it works totally in silence. So we must try to improve our immune system so that all the disease causing organisms which are trying to invade our body can be prevented. Thank you very much.